It's a decade for action. It's a decade for action. From commitment to action. From commitment to action. It's a decade for action. Diseño por la acción. Diseño por la acción. The language mental action. The language mental action. We're singing for help. Affordable health. Quality healthcare. Yeah. Singing. From commitment to action. Universal health coverage in Africa. In Africa. It's a decade for action. It's a decade for action. From commitment to action. Sing it louder. From commitment to action. Let's come together. It's a decade for action. Diseño por la acción. Diseño por la acción. The language mental action. The language mental action. Diseño por la acción. Diseño por la acción. Diseño por la acción. The language mental action. The language mental action. Diseño por la acción.
From commitment to action.
What an inspirational sound, what an inspirational performance. Welcome all of you to the 4th edition of the Africa Health Agenda International Conference, AHAIC 2021, themed Decade for Action, Driving Momentum to Achieve UHC in Africa. My name is Desta Lako. I am the Global Partnership Director for Amref Health Africa, and this is the largest convening of thought leaders in the region, and one which actually reflects an Africa-owned health narrative. Over the course of the next 3 days, there will be 5,000 delegates who are registered to attend this conference, of whom more than 50% are women. And in addition, 54% of our women speakers our speakers are women. So how amazing it is that we are actually opening up the conference today in a wonderful way to celebrate the International Women's Day, recognizing all these women leaders on whose shoulders we stand, and certainly the young leaders to whom we pass the baton. We have a stellar program lined up for you for the next 3 days. This opening session is being live streamed by CNBC. We hope you will also amplify the information you hear through social media handles. The hashtags for this conference are hashtag AHAIC2021, that's hashtag AHAIC 2021, or hashtag Africa Health Agenda. And now I have the honor of introducing Dr. Githinji Gitahi, who is the Global CEO of Amref Health Africa. Thank you again for joining us today.
Thank you so much, Desta. I was here enjoying the video and what great African music there, and calling this a decade for action. Many of you will know that we have only 10 years to go before all our commitments to humanity are actually achieved, and universal health coverage has only those 10 years, and yet we know that many countries across the world, and specifically in Africa, are still struggling with achievement and a clear roadmap to UHC. We will hear a lot during this conference, during different sessions that are partner shared, but I first want to start with the protocols, and I will be recognizing the presence of His Excellency, the President Uhuru Kenyatta, who will be joining us in about 5 minutes to open this conference. We have, of course, the honor of hosting the Director General, Dr. Tedros Adhanom. And we also have Dr. John Kengasong, who is the Director of Africa CDC. We have several ministers, including my own minister here in Kenya, Senator Mutahi Kagwe, and several other ministers. We have diplomatic corps. And I want to give a big shout out to all women in the organizing committee. I will let you know that the organizing committee was made up majority of women, and all the women in this organizing committee, partners and speakers. But this conference is co-hosted by myself and my chair of the international board, who is here with us and will be speaking with us. You know, Amref Health Africa is co-hosting this with many partners, but of course, Amref Health Africa has an international board, and the chair, Dr. Charles Okehalam, is also here with us, and I would like to recognize his presence and support at this conference. He'll be speaking to us shortly. Ladies and gentlemen, we will do all these protocols before the President Uhuru Kenyatta joins us, but I would like to actually also take this opportunity to thank partners. Africa CDC, to start with, who are co-hosting this with us. So thank you, my brother John Kengasong, for the leadership and for answering the call across the continent, and to us to co-host this conference with you. But I would like also to pay special attention to specific partners who are actually at the top level of the hosting of this conference: Takeda Pharmaceuticals, Roche Pharmaceuticals, the International Federation of Pharmaceutical Manufacturers Association, IFPMA, Johnson & Johnson, and then a lot of other partners, more than 20 partners, who include private sector, UN agencies, civil society, and others who are here, who have enabled this conference to be hosted here. There will be key initiatives that are going to be launched or discussed at this conference. The first one, first and foremost, is the State of UHC in Africa report, which will be done by the AHAIC Commission for the State of UHC in Africa. They will be discussing at the end of this opening session after the opening ceremony, the state of UHC in Africa and the report, an executive report, has been developed. And this is an important milestone because this commission has been led by Africa. Is actually, all the commissioners are African experts looking at health from an African point of view. This is why we think that this is an extremely important report, and of course has borrowed heavily from all the work done by agencies like WHO, World Bank, UHC 2030, and others. I'm glad to say one of the UHC 2030 co-chairs will also be speaking at this conference. Secondly, we will be talking about an index called the Sustainability Index for future-proofing health in Africa, which has also got many experts who have been working on it. It's going to be launched as this conference is being supported by Roche. We are also going to be seeing a growing partnership between the Gates Ventures and Amref Health Africa, launching an initiative called Exemplars in global health that is going to be looking at creating partnerships for South-South learning. As you know, the Africa Health Agenda International Conference was created by Amref Health Africa to give a space for Africa to discuss the Africa Health Agenda. And of course, that cannot be done without recognizing all the global partners who actually support Africa to achieve lasting health change. But that needs to be seen from an African point of view, and solutions need to be contextualized for Africa, as we have seen with COVID-19, which we've worked on very closely with WHO, WHO Afro, and Africa CDC. It has been extremely important to ensure that all the responses we give are contextualized to the continent of Africa. I would now like to introduce the chair of the Amref International Board, who is here with me, Dr. Charles Okeahalam. Dr. Charles Okeahalam, who is based in between, I ask him all the time, where are you based? He says he's based between Lagos and Joburg and the rest of the world. And Dr. Charles Okeahalam is a renowned scholar, a businessman who has been involved in financing in many ventures and sectors in Africa, and also has a great heart for sponsoring female students in different universities. So he actually applies his own resources to ensure that female education is advanced. He's been a member of many councils of different universities in the continent. Currently, he chairs the board of trustees of Amref International University. He is an honorary professor of Vist University and also a recipient of the Hublot-Norman Senior Fellow Award from the Bank of England. I can tell you that having worked closely with Charles, he has a great passion for health in Africa, including the economics of it, and a great passion for the development and leadership of women. Charles, over to you for your 3-minute remarks. Yes.
Thank you very much, Kithinji. Thank you for this opportunity. Ladies and gentlemen, I'm delighted to add to Kithinji's hearty welcome to this 4th edition of the Africa Agenda International Conference. I'd like to follow protocol and recognize His Excellency President Uhuru Kenyatta, Dr. Tedros Ghebreyesus, Dr. John Nkengasong, and indeed everybody, ladies and gentlemen. I will quip that when the CEO, the group CEO of an organization flatters the chair with colorful words, and the chairman should stand back a little bit and then wonder what that is about. So I want to thank Kithinji for those very warm words, and take it with the great intention with which it was put forward. His Excellency President Kenyatta, ladies and gentlemen, we have to recognize that today is International Women's Day. And I'm proud to serve as chairman of the International Board of Amref Health Africa. Amref Health Africa is an organization which is totally committed to gender equality and gender equity. And those two things are different. But it's important that there's great focus and emphasis on them. And as Kithinji pointed out, I'm very keen on that agenda. So this is an important day, and it's auspicious that we launch this conference on Women's Day. So happy International Women's Day to everybody, And I hope that it's going to be a great day and that we will reflect on the importance and the significance of the role of gender in our lives. It has been, as I said, 60 years, more than 60 years, since Archibald McIndoe, Michael Wood, and Tom Rees established Amref. Amref continues to take the lead in thought leadership on health matters across the continent, and we try to contribute to the general discourse at a global level as well. And of course, it's important in the context of the current systemic shock that we face now. And in fact, that's what COVID is. It's a systemic shock across all sectors. It's not just a health crisis. So this conference is unlike the other conferences in that it comes at a time when we need actually to find ways to address our health issues in a holistic manner, in a systemic manner. And COVID has also shown us, if I may say so, that the global commons, that health is a global commons. It's not for one nation or for one other nation. There is no discrepancy. It has no particular sectoral or social or national focus. It's across the board. And then critical to that, and if I throw my hat in as an economist, the issue now we have to ask ourselves, particularly in the context of Africa, is what is the bigger shock? The systemic shock is across the board, but what is the bigger shock? What can we contribute to addressing the discourse on the trade-offs between the economy and the health issues? And I think that the conference would gain by us thinking about those issues carefully. If you look at what's happened to African economies, you can see what this health challenge poses, the challenge it poses. The debt service ratios have increased, GDP, debt to GDP ratios have increased, terms of trade have gotten worse, and there's evidence that there is a bit of a commodities rally, but nonetheless, the fiscal position, and therefore the health expenditure, domestic health expenditure capacity of African countries is being greatly reduced. And therefore, there is a challenge. And this challenge is going to be augmented by the situation with regards to vaccines. We have to be very, very mindful that we address this challenge and we find ways in which we can cooperate to meet this challenge. So as I pointed out, health outcomes in Africa are improving but remain low. The continent has 17% or so of the world's population, but has 23% or so of the global burden of disease. Our mean life expectancy is more or less 7 years lower than the global average. And we have had, over the last 15 years, a huge burden with regards to HIV, Ebola, cholera, measles, and the rest of other challenges, and now COVID. So we are convening here today an opportunity to share all our learnings across the continent and internationally with the whole range of stakeholders. The privilege that we have of having His Excellency here from the perspective of government is critical, and having a whole range of other government representatives here, because they are the custodians of policy. And it's important that we are able to take on from them and contribute to what they're thinking and share this thinking. So policymakers and government have a critical role to play. The private sector is critical. 65% of health is delivered through the private sector. And so the private sector has this critical role to play. Of course, we know of civil society's important role, and academia, the thought leadership, the sharing of ideas that come out from research and the dissemination of that research. So it is my hope that we are able, ladies and gentlemen, to deliberate successfully, come up with solutions. Because unlike the previous conferences, and I need to repeat it, we face a real challenge. And so in convening this conference, we We need to find ways to find solutions that are efficient, solutions that are going to meet our immediate challenge. So I'll focus now on three issues very briefly. I think, as I said earlier, international cooperation will be the key to the solution of and solving the COVID issue. Not pointing fingers, but cooperating across the board. And I hope that international partners, donor agencies, the G7, the G20 will support and put as much pressure as possible for this international cooperation to take place. Then the second point is that we have to have effective communication. We have to be able to communicate our policies effectively to people. We have to enhance this. Gitinji made the point about how much I travel, but I don't think I'm unique in that regard. But I wanted to just make a quick point that I have observed across the continent in the last month or so, the vast difference in the way in which the communication of this challenge of COVID is being put out. There is no standard method. And I know it can't be standard, but there is a challenge that in some places, I have this perception that the threat of COVID is not being taken as seriously as it should be, and we need to communicate this effectively. And then finally, ladies and gentlemen, we need to enhance efficiency in our allocation of resources. And I think if we can do those three things, we'll be on the right path. And I think that this conference is going to be an interesting conference that leads to much thought leadership. So echoing from Gitinji's welcome address, this is our collective conference. There is no other large convening for us to discuss Africa's health agenda. You are certainly at the right place. I want to thank you again for joining us, and I'll hand over back to you, Gitinji.
Thank you very much. I know we are going on to the next speaker, but I would like to recognize the presence of His Excellency, President Uhuru Kenyatta, President of the Republic of Kenya. Thank you, Your Excellency, for joining us, and we'll be coming to you shortly. Thank you very, very much. The person speaking prior to your joining is the chairman of Amref Health Africa International Board, Charles Okeahalam. I would now like to request my brother, Dr. John Kengasong. John Kengasong is the director of Africa CDC, a renowned virologist, worked earlier with CDC Atlanta. He is a Cameroonian virologist. We are really proud to have an African of such status actually lead the Africa CDC. So John, over to you for your quick 3-minute remarks.
Thank you. Thank you, my brother Gitinji, for the wonderful organization. And I've always admired your organizational skills since the first time we met a few years ago, how you managed to mobilize all of these people. I don't know what you do to them, so that next time you can let me know so that I can use the same formulas to get everybody to come to this platform. So greetings to His Excellency, President Uhuru Kenyatta, and Excellency Dr. Tedros Ghebreyesus Adhanom. Greetings to all the excellencies who are on this platform. But let me first of all join all of us in celebrating today's International Women's Day. I think this is our day. We are all gathered today because of women. They gave birth to us, so this is our day. So, and greetings from the Africa Centers for Disease Control and Prevention from the headquarters of the African Union. Thank you for the opportunity to share these brief remarks on this very important discussion of accelerating universal healthcare coverage on the continent. As we all know, the global fight against the ongoing COVID-19 pandemic continues into the second year, continuing one of the most unprecedented health challenges and economic crisis globally. As a matter of fact, I've always stated that I don't know of any crisis that have threatened our continent since independence as the COVID-19 pandemic that we are currently fighting. The African Union's Agenda 2063, the continent's strategic framework for transforming Africa into the global powerhouse of the future identifies health as one of the core areas of focus, including investment in infrastructure, workforce development, and expansion of health services across the continent. Against this backdrop and in the wake of COVID-19 pandemic, ladies and gentlemen, investing in universal health care has never been more critical. As we have seen in the past with outbreaks and pandemics, for example, the 2014 Ebola outbreak in the Democratic Republic of Congo and in West Africa, and even now in the COVID-19 pandemic, we have seen how pandemics can significantly disrupt healthcare services, whether it is in immunization programs, maternal and neonatal healthcare, or routine testing and treatment for other illnesses, including HIV/AIDS, tuberculosis, and malaria. Investing in the competent workforce development is critical to achieve the expanded universal health coverage on our continent. Ensuring that public health systems have a strong workforce, requiring starting early, understanding the gaps and risks in the current healthcare systems, and building capacity through collaboration and partnerships. On this, let me pause and repeat my favorite proverb. I always say here is that you do not dig your wells when you are thirsty. You dig your wells before you are thirsty. So you build your healthcare system before you need them. You don't need them and you start building them. I think we have to change that paradigm. Developing preparedness response plans and investing in workforce development is key to ensuring quality services delivery during what would otherwise be a difficult and stressful time in public health professionals. These factors are critical to growing our capacity to providing a multitude of healthcare services across the board. That is what we mean by a resilient healthcare system that can be used in addressing our current needs and then prepare us to fight subsequent pandemics or outbreaks. In order to accomplish this, the Africa Centers for Disease Control and Prevention welcome local and global partnerships with multi-sectoral, national, regional, and global organizations committed to scaling up universal health care coverage across our continent. I'm confident that this forum will yield great discussions and innovative strategies to grow universal health care across our continent. Thank you for the opportunity to speak with you. At this time, colleagues, ladies and gentlemen, excellencies, it is my great pleasure to introduce Dr. Tedros Ghebreyesus, who is the Director General of the World Health Organization, to share his remarks. I thank you.
Thank you, John. Thank you, my brother. And thank you, Dr. Gitahi. Your Excellency, President Kenyatta, Dr. John Kengasong, Dr. Gitahi, Dr. Okia Halam, Excellencies, distinguished guests, dear colleagues and friends. Good afternoon and thank you for the opportunity to join you today. Asante sana. And I would like to add my recognition of International Women's Day. Globally, women make up 70% of the health workforce, but women are unrepresented in leadership in global health. In February, WHO launched the Gender Equal Health and Care Workforce Initiative to promote gender equality in health leadership. When COVID-19 first emerged more than a year ago, we were deeply concerned about its potential impact in our continent in Africa and other regions with fragile health systems. So far, almost 4 million cases have been reported from African Union countries, and we have lost more than 100,000 of our brothers and sisters. We know that the real numbers are higher, but the pandemic is a surprising paradox. Some of the wealthiest countries with the most advanced medical technology have been hardest hit, while many countries in Africa have managed to prevent or control widespread community transmission. Our continent's relatively young population means Africa has not seen the same scale of severe disease and deaths as other regions with older populations. Africa has also benefited from its long experience in applying basic public health tools to prevent and respond to outbreaks of infectious disease. The approval of safe and effective vaccines is now giving us all hope of bringing the pandemic under control. For more than a year, we have been working with our partners to ensure equitable access to vaccines, diagnostics, and therapeutics in Africa. So far, around 14 million doses of COVID-19 vaccines have been delivered to 19 countries in Africa through COVAX, and more countries will receive doses this week. This is a good start, but we have a lot of work left to do and barriers to overcome. But even once the pandemic recedes, we will still be left with many of the same challenges we had before. There is no vaccine for poverty, hunger, inequality, climate change, child marriage, or many of the other problems our brothers and sisters face on a daily basis. The pandemic has highlighted the centrality of health. When health is protected, everything is possible. When health is at risk, everything is at risk. The pandemic has taught us that health cannot be seen simply as a product of strong and prosperous nations, but as their foundation. A healthy population is a productive, innovative, and resilient population. Far from taking the focus away from universal health coverage, the pandemic has only shown why it's so important. Achieving UHC requires investments in resilient health systems, especially in strong primary health care, with an emphasis on promoting health and preventing disease. An important part of that journey is ensuring a reliable supply of safe, effective, and high-quality medicines across the continent. To that end, WHO is working with the African Union and the Africa CDC to establish the African Medicines Agency. And I call on all AU countries to ratify the treaty so that Africa Medicines Agency can enter into force. More than 2 years ago, I was honored to join President Kenyatta in Kisumu to launch Kenya's pilot program on universal health coverage. WHO is proud to have supported Kenya in the design of this project, and we're committed to supporting all countries in Africa to end the pandemic, improve preparedness, and build the strong, resilient health systems for the healthier, safer, and fairer Africa we all want. And I would like to recognize His Excellency, President Kenyatta's commitment and leadership on universal health coverage. And thank you so much also for joining us today. That shows your commitment to UHC. Thank you. Asante sana.
Thank you. Thank you so much, Director General Tedros. You know, you've driven the vaccine equity conversation so strongly. And I clearly remember your statement that the world is facing a catastrophic moral failure on vaccines. So thank you very, very much for joining us. And now it's my singular honor to welcome His Excellency President Uhuru Kenyatta, who, of course, Tedros has referred to as a champion of UHC. And I'll be inviting him to speak to us now and also declare the conference open. Your Excellency, thank you so much for joining us today. And the time is yours now. Thank you.
Thank you very much, Dr. Gitahi. I appreciate it. And let me begin by saying it is a great pleasure to join all of you this afternoon as we discuss this great and most important subject. And I begin by recognizing my good friend and dear brother, Dr. Tedros Adhanom Ghebreyesus, our Director General of the World Health Organization, who has ably led us in Africa and indeed the whole world in combating this pandemic that faces us. Let me also recognize Dr. John Gengasong from CDC Africa, and say what a pleasure and honor it has been to work with you, Dr. John, last year as a member of the African Union Bureau. And it's been wonderful, and your contribution to helping us fight this pandemic shall always be greatly recognized. Recognize also Professor Charles Okehalem, the Chairman of Board of Directors of Amref Health Africa, all members of the diplomatic corps, the health and policy and business leaders, and indeed, most importantly, our young health advocates who have joined us today. We meet here today as the world continues to grapple with the worst international public health emergency in over a century. In its wake, COVID-19 has changed the way we live and work and has heralded a new normal in which virtual meetings provide a safe way for the world to continue engaging. It is my great pleasure to join you, as I have said, for the opening of the 4th Africa Health Agenda International Conference, and I congratulate Amref Health Africa and the Africa Center for Disease Control and Prevention Africa for using this series of conferences to maintain a momentum on this most critical agenda. The theme of our conference this year, a decade for action, driving momentum to achieve universal health coverage in Africa, has a special significance in Africa and the world. The devastating social economic impacts of COVID-19 pandemic have demonstrated to all of us the centrality of health in our development efforts. Indeed, it is clear that our global economic and social recovery hinges on how effectively the global community, continental as well as regional bodies, and individual states are able to control diseases. I'm pleased to note today the strong participation of our young people in this conference as speakers, but also in this plenary session. The youth are a key constituency in driving momentum towards UHC, and they should never be sidelined. We should engage with and empower our young people and give them the knowledge and skills to take charge of their health. In this context, I would also urge the conference to give special attention to health issues that plague our young people, which include teenage pregnancies, alcohol and substance abuse, lifestyle diseases, epidemics such as HIV and AIDS, as well as mental health, amongst others. We should also not lose sight of the fact that some of these health issues have been exacerbated during this COVID-19 pandemic. Ladies and gentlemen, our forefathers envisioned an African continent that was free from poverty, ignorance, and disease. We have indeed made significant progress towards the realization of this vision. Diseases such as smallpox and polio have been eradicated due to sustained vaccination efforts. The burden of malaria cases on our continent has also been greatly reduced through effective coverage with insecticide-treated nets and treatment of pregnant women and children in endemic areas. Equally encouraging, access to reproductive health services has improved maternal health outcomes, resulting in fewer maternal and child deaths across our continent. As a result, life expectancy in sub-Saharan Africa has increased from 40 years in the early 1960s to 64 years currently today, albeit with wide variations across our region. However, ladies and gentlemen, there is still plenty that needs to be done to achieve our SDG 3, which entails ensuring healthy lives and promoting the well-being for all at all ages. African countries, including Kenya, continue to suffer from the double burden of disease, which can be drastically reduced with much better healthcare. Indeed, the prevalence of preventable diseases such as respiratory conditions, diarrheal diseases, HIV, AIDS, TB, and malaria, as well as the rising burden of non-communicable diseases, including diabetes, cancer, cardiovascular disease, such as heart attacks, and chronic respiratory diseases, such as asthma, continues to pose a very significant challenge to us on the continent. So, ladies and gentlemen, what then should be the Africa Health Agenda for 2021? And this, if we are to achieve, as we have agreed, universal health coverage by the year 2030. I would like at this juncture to propose a few priority areas that I consider should anchor our health policies and programs as we move forward. The first is that we need to give greater priority to primary health care, including maternal and child health services, water sanitation, hygiene. Indeed, during this COVID period, all of us have been amazed by how simple hygiene practices, such as hand washing, introduced during this response to this pandemic, have reduced diarrheal and other diseases. The second is to increase access to healthcare services. Currently, about 600 million people across our continent do not have access to adequate health services. To address this, we must make increased investments in physical facilities, medical equipment, drugs, as well as trained personnel. In Kenya, we have equipped nearly 100 hospitals with advanced medical equipment in operating theaters, radiology, renal units, and intensive care units. We have also started a rollout of 24 primary healthcare facilities in the informal settlements of our capital city, Nairobi, where millions have little access to healthcare services. The third is that we need to make healthcare much more affordable. Many families on the African continent resort to selling off family assets in order to pay for medical care for their loved ones. Currently, at least 15 million people in Africa are pushed into poverty annually because of out-of-pocket healthcare payments. In Kenya, we have partly addressed the problem through the removal of user charges in dispensaries and health centers, as well as through the introduction of free maternity health services. Currently, we are embarking on a national program to ensure universal access to health hospital insurance fund through mandatory enrollment and a full government subsidy for the poor and most vulnerable. Fourth, we need to harness the innovative energy and creativity witnessed in Africa in response to the COVID-19 pandemic. Many African countries are now locally producing protective personal equipment and other medical supplies. I urge health providers, investors, as well as our development partners participating in this conference to nurture such innovations, especially those that are led by our young people. These local level successes in fighting COVID-19 can be a strong foundation for increasing capacities and capabilities for domestic manufacturing of essential medical commodities, drugs, vaccines required in other disease and healthcare situations. Fifth, we need to strengthen health sector collaboration and coordination across different levels of government, across different nations, within countries, with the private sector, and also with our citizenry. During the past year, we have witnessed the power of collaboration and citizen engagement. If we are to achieve UHC by 2030, the mission must not be one of just the national government alone. It will take the combined effort and close collaboration of national as well as county or devolved leadership, religious leaders, civil society organizations, our private sector, and indeed our ordinary citizens. Between our nations, we must collaborate and coordinate. And as I said earlier, we have shown this when the African Union Bureau of our Assembly of Heads of State and Government successfully developed continental COVID-19 strategies and the Africa Medical Supplies Procurement Platform. This we did by working together. Similarly, the unprecedented global response that has enabled us all to develop a framework for confronting the pandemic and to develop vaccines in record time should be harnessed towards securing universal health coverage by 2030. Indeed, I must say that I am a proud African that today our African continent is only weeks behind the developed world in terms of making vaccines available to our citizenry, especially those on the front line. 6, we need to improve health security. And as COVID-19 has demonstrated, our global health systems are indeed vulnerable. A health problem in one country can quickly translate into a global catastrophe. We therefore need to redouble our efforts towards achieving universal health care with a greater focus on public health and a reduction in health inequality. 7, the COVID-19 pandemic has demonstrated that political will and leadership is strongly correlated with successful health responses and a greater resilience in our health systems. And I therefore call upon all leaders on our African continent to give health the highest political commitment and to pursue the attainment of universal health care as a critical driver of social development and economic prosperity. Ladies and gentlemen, I urge us all to reject the pessimism and cynicism that may come from our current circumstances. Instead, let us embrace empowerment that comes from optimism and hope, even in uncertain times. The theme of this conference, the Decade for Action, driving momentum to achieve universal health coverage in Africa, presents all of us with an opportunity to reflect, to learn, and indeed to relearn and to re-examine previously deployed health strategies in terms of their effectiveness. Ladies and gentlemen, the achievement of universal health coverage is a personal priority of mine and my administration. Indeed, it is one of the pillars of my administration's social economic development plan, which we have dubbed the Big Four Agenda, and it is also embedded in our Kenya Vision 2030. As I address you today, as I said earlier, Kenyan health workers are receiving COVID-19 vaccines to ensure that they are safe, even as they continue to battle on the front lines of this pandemic. We could not have achieved this without working closely with all of you, and indeed with all our partners. And for this, I applaud each and every one of you. Finally, ladies and gentlemen, I am informed that this conference will launch a report on the state of UHC in Africa. This review by experts from the continent will tell us how far we have come in the UHC journey and how we can accelerate it. And I personally look forward to receiving the report and to working with all of you to achieve this critical agenda. As I conclude, I want to join my fellow participants to celebrate the great women, not only of Kenya, but all the world over, in celebrating the International Women's Day 2021. This year's Women's Day has chosen the theme, Choose to Challenge. This theme, expounded, illustrates a challenged world, is an alert world, and from a challenge comes change. I therefore impress on everyone to borrow from this theme and celebrate our women and recognize their critical contribution, not only to our societies, but also to our economies. Last week, I joined elders and leaders from Samburu County here in Kenya to launch our campaign to end FGM and early child marriages by the year 2022. And I call upon all participants to also join us in this effort to ensure that women are able to play their rightful role in society. I join the many Kenyans to honor all women who have been in the front line last year and to date in our fight against COVID-19, as doctors, as paramedics, as nurses, as community health workers. And I say to all of you, Happy Women's Day. It is now my distinct pleasure and honor to declare this conference officially open and to wish all of you very, very fruitful deliberations. Thank you all.
Fantastic. Please unmute yourself and let's give His Excellency a big clap for a fantastic speech. I think the commissioners for UHC report will take note of your 7 points, Your Excellency, because having read the draft report, we should actually have had you as a commissioner on the state of UHC in Africa. Thank you. Thank you so much, Your Excellency. The conference now is officially open. I must thank all the guests in the open